Welcome, everybody. I am so excited to introduce our two panelists today, Matt with Abyde and Ali with HR for Health. So both are the CEOs of the companies, and this is a partnership that we have been working on for quite some time, and there's so much synergy between the HR compliance and the HIPAA and OSHA compliance. And so as customers of both Abyde and HR for Health, we want to give you guys the inside look on what is this partnership about, what are both companies coming together to really accomplish for our customers. And so with that, I would like to introduce Matt and Ali and let them kind of take it from here to again go through the ins and outs of what this partnership looks like, how our clients are going to be able to benefit from it so that they really achieve, like we're saying, the ultimate compliance through this partnership. So welcome.
Awesome.
Thanks, Jill. Yeah, appreciate that.
Yeah, I know this is awesome, Matt. Nice to have you on here. Excited to introduce you to our clients and excited to meet your customers as well. And your journey has been a really sort of interesting one. So I'd love to sort of hear about that a little bit, because I know you and your partner kind of founded Abyde in your garage and whatnot. So tell us a little bit about that.
Yeah, and that we're all great tech company starters in their garage, right? Or at least I was told that. So we try to incorporate that into our story. But yeah, I guess to kind of peel back even before that a little bit, my background's in healthcare IT. And so I worked for a mom and pop IT company based out of New York, and we worked primarily in the eye care space. And this was 2009, 2010 with the High Tech Act coming out in 2000, right around that time, 2011. We had a lot of our customers that were part of meaningful use, and it was through those meaningful use audits that they were coming back to us as their IT company saying, hey, nobody's helping us with this security risk analysis mandate that's part of meaningful use. And we looked at it at the time, and clearly there's a lot more that goes into HIPAA compliance than just technology. But as an IT company, we saw a great opportunity for us to provide some services around HIPAA compliance for our existing IT customer base. Unfortunately, right, like most consulting services, it wasn't really a scalable model, and we were butting up against resource ceilings and different things like that. And so in my mind, there was an easier way, there was a more cost-effective way, even especially for the practices themselves. But it was like TurboTax for HIPAA, right? Just kind of a really easy to use solution that doesn't take up many resources from inside the practice. It gives the power back to the practice, whereas when we were doing consulting, they had to wait on us for the documentation. We had to get answers from them. It was a very kind of a disjointed process. And so really kind of give them the power to streamline their compliance programs, implement and then sustain, which is a key to this. And so, it didn't work out with the company that I was with, but, like I was mentioning, all great ideas starting a garage. It was my partner now and I sitting in there swinging a golf club, drinking a beer one night, and he's kind of picking my brain on like, what would you want this software to do, and how does it need to act? And I didn't know his background really, but he had all the developmental and financial and entrepreneurial experience, whereas I kind of had an idea of what the software needed to do, how it needed to act. I knew we could sell it. I knew there was a need in the market. And then you put us two together in a garage and good things happen. So, we launched with really just the idea of, I left my job at the time, before we even started in development, and wanted to start Abyde the right way. And, it was like, all right, if we can get 50, 60 customers the first year and, prove that this thing could be sold, at least I can eat. My wife and I were newly married at the time. We're trying to start a family, and it's like, all right, we can take care of my family. And I think we ended up with about 450 customers that first year. So it was like we knew we were onto something, and really kind of never looked back. And ultimately, the model that we initiated within the eye care industry is the same model that works extremely well in any independent practice environment, which is why we've experienced such great success in dental.
Yeah, no, that's awesome. That's awesome. And you guys are just only a slightly smaller than Apple, right? Another famous company that started in a garage, I think, right? So
just a little bit. If we're on, if we're on that same track, then we're happy. We may be a lot further down the road.
That's right. Up the road, I guess. That's right. I read somewhere that like Clearwater is like the next Palo Alto, so I'm excited to see that. So
it's crazy because when we started this thing, even Tampa was, it's definitely not a tech hub, but it's crazy what's happened through COVID and the different technology companies that have found this little hidden gem in Tampa. Now we're even in a little bit further of a niche in Clearwater. But you know what, it works for us, and it's where I grew up, and it's really neat just kind of, you know, building a business in a place that they have so many roots.
Yeah, absolutely. And, you know, and your story is so fantastic and so in line with sort of our story as well, because it came out of a need, especially with you being in IT and working for, you know, a small mom and pop organization. And our story is very similar to that, actually, which is pretty neat because, you know, as a healthcare attorney, I saw the same need. I saw a need where a lot of our doctors were getting sued for these HR violations. And you know, we started in dental as opposed to in eye care where you did, but we grew into eye care as a result because, you know, like you said, the need is the same across the board, right? The need is the same across the board. And the nice thing is that when you come from a place where you know there's a need and you have a solution, but you just need to automate it so that it can scale and grow, that's really exciting, you know. And for us, it's been a very similar journey in the sense that, you know, we developed it, you know, initially with the idea of just having our clients be HR compliant with some of the more basic things. You know, we found, and I'm sure you saw this too when you were starting, we found a lot of our doctors around the country were using, you know, these, you know, outdated employment manuals that they were getting from, like, you know, payroll companies or, you know, these like mom and pop organizations, and like they didn't have the whole HR sort of suite of things that they needed to be HR compliant. They were just relying on their manual, and that was getting them in trouble. And so, you know, like you, we ended up, you know, developing the software so we could scale. We developed the software so that we could get it out to as many people as possible with, you know, all the basic things that you need to be HR compliant. And it's been a blessing to be able to talk about it and nationally and have our doctors use it, because I know they're so much better off, you know. So it's neat that, you know, our stories kind of started in the same fashion. So.
Yeah, I mean, it seems to be an area that not a whole lot of people want to kind of venture into, right? But I think, you know, when you do it and you do it the right way, you can change perspectives on, you know, those different areas. And I think together, that's the cool thing about what we're doing as a partnership and as organizations is, you know, our mission is to revolutionize compliance. Is I guess as ambitious as that is, and pretty open-ended, but, you know, when we're able to, you know, sit practices down and show them who we are, what we do, how we do it a little bit differently, it's exactly what we're doing, is revolutionizing an area that, you know, for the most part is been untouched or ignored for a long time.
Yeah, absolutely, absolutely. So let's get into the details. I'd love to, you know, I'll describe a little bit about what HR for Health does, but Matt, why don't you tell us what Abyde does for our audience? Because, you know, when people hear HIPAA, you know, when they, you know, hear OSHA, it's all confusing, right? You know, and so can you break it down? Just, you know, what are the services? What is the problem that you're trying to solve?
Yeah, so really what we're trying to do is simplify compliance as much as we can. And so Abyde is the easiest way for dental practices or independent medical practices to implement and sustain HIPAA and OSHA compliance programs. I kind of alluded to it a little bit ago, but there's a lot more that goes into HIPAA compliance, and you just did as well when it comes to HR, right? There's more that goes into it than just the binder or just training or just policies, whatever it may be. And those are some of the misconceptions that we're trying to overcome. And so we wanted to provide a full solution, a full suite that encompasses all aspects of compliance. And so, as I mentioned it before, you know, think of Abyde as TurboTax for HIPAA or TurboTax for OSHA, where you just fill in profile information, you answer questions, really easy to understand questions. There are no yes, don't know answers, right? And based off of that information, the software then dynamically generates all the documentation they need to prove that they're compliant. And I think that's, you know, one of the misconceptions that we have out there is, you know, we hear is just like, what does it mean to be compliant, right? Like, what is the government? In our eyes, you can talk about all the definitions that you want, but what does the government say that you need to do to be compliant? And that's ultimately where our focus is. And so we like to think of our definition, or the government's definition of compliance, is it's documented proof there's a culture of compliance within the organization, right? And so many practices get the culture correctly, right? And when it comes to HIPAA compliance, they understand they can't share information at will. They understand there are, different parameters they need to have in place with the technical safeguards or even physical accessibility when the office, who can access what, right? Or when it comes to OSHA, they understand they need to provide a safe and healthy work environment for their employees. But what does the government need to see? How do they document that? And so, not only the educational aspect becomes part of the problem for these medical practices, but then the execution, right? We think about compliance as this puzzle picture, and when we educate, which we love to do, we look at it as a puzzle picture. So we give that visual of, you can have the manual, but it's just one piece of the larger picture. And so without that comprehensive documented compliance program, the government doesn't look at it as if it's complete. Right. And so, each individual piece carries its own weight, its own value, but without it, right, without the full picture, you can't consider yourself compliant. And so that's what we love to do is make it easy for them to execute. But then, even on the front end of that, if they're not educated properly, not only will they never make a wise business decision because they're not going to have the right information, but there's really no problem, right? And I think that's one of the things that we have to overcome is, HIPAA's been around for a certain amount of years. Why now? Why do we need to act now? And I'm sure we'll get into that in today's conversation. But I guess that's as simple as I can state what it is that we do here on a regular basis.
Well, like most things in life, right? Not everything is just black and white when it comes to compliance, right? There are so many different pieces of it. Like even when we think about our own health, right? It's not enough just to eat well, right? Like you also have to exercise. You also have to get a good night's sleep. You also, have to, maybe, meditate and have, peace of mind as well. And all these things fit into one another in a really kind of a complex way that gives you that, total body health, if you will, right? And so the same thing is true with compliance. It's not just about the manual. It's not just about one thing. It's about all of these things. And I think you hit it on the head because on the HR side, we see something very similar, which is people tend to want to do one piece of it because maybe it's the easiest piece, but then not really realizing that to get compliance, you need all of them. And historically, HR, HIPAA, OSHA, right, have been really complex, right? Have been really complex to kind of figure out and get compliant on. And quite frankly, our doctors, including my own wife who has her practice, are too busy to kind of figure out all the HIPAA and OSHA and HR laws, right? I mean, it's not their job. And so what I think we've done and what you've done as well is be able to simplify that so that the doctors can get compliant in their practices, be able to implement these policies. Yeah, there's a little bit of work that's needed, but you get compliant and then you can put it on autopilot moving forward. And that's what we've seen with our thousands and thousands of clients. It basically comes down to let's get your HR documents in place, right? So that includes the manual, of course, but it also includes our new hire documents, right? It includes making sure that you're doing performance reviews correctly, right? You're doing violations correctly. And what I think differentiates our software, and I'm sure there's a bunch of stuff that you do too that differentiate you, but one of the things that I love is our time clock, right? People overlook the time clock because they think, oh, you know what, I'm going to use my EHR system or my practice management software just to clock in and clock out, and that's all my team needs. But with all the laws changing around the country, these time clocks have to be tied to benefits, right? Vacations, sick leave, all these other things that are tied to it, and be able to bring it all in under one roof in a seamless kind of efficient manner makes all the difference in the world. And and I think that I think what differentiates each of our companies is the fact that we simplify super complex concepts and compliance requirements into a software module that allows the doctors to be compliant, but then more importantly, be able to put it on auto drive and never look back. A little bit of maintenance, but never look back.
Well, and that's the thing, right? You have to do something, right? Yeah. I mean, it is a requirement. It's a law. You said it multiple times, and so it's it's not the question of should I do this, right? This isn't a nice to have. This isn't a patient recall system. This isn't, the latest diagnostic equipment. I mean, these are federal and state laws. So, there's not a suggestion. And so, then the question is, well, how do I execute? How do I get it done as easily and effectively as possible? And you mentioned it, we feel like we both have the best solutions in our area for that. And, what a great way to provide a solution to an area that's, again, been underserved, for the majority of time.
So I'm gonna have you brag now a little bit, Matt. I know it goes against like your ethos, but let's talk about what makes Abyde competitively better than any solution out there, and I'll share a little bit about HR for Health too.
Yeah, ease of use, right? Simplification is probably the biggest thing that we hear from customers. When you get into the actual features of Abyde, what we do is automate. And so it's a lot of automation, as I mentioned before, where the action steps or the objectives for a practice to complete are really simple. So whether that's just answering questions or filling in general information about the practice, but the software then goes to work and it disseminates all that information out to all the specific policies and procedures for the practice, which saves them, the first year probably saves them somewhere around 75 hours over the course of that first year, because there's the risk analysis requirement, which is an extremely heavy lift for a practice that's trying to take it on their own or utilizing an outdated maybe checklist or even the government tool. And so that automation around our easy to use risk assessment saves a ton of hours. And then the policies and procedures that are drafted and edited automatically as those answers change over time. So maybe there are some solutions or procedures that are implemented that we ask about, and that information is then taken out and sparsed out to all the policies and procedures that are affected. So that whole automation process is what makes it easy. We have a notification system developed in the software as well, so it can be out of sight, out of mind for the practice. We don't want it to be something that they're logging into every day. They don't need to. And so we send them those notifications or those objectives, via email, telling them they need to log in and outlining those action steps that need to be taken care of. So a very easy to follow process. And then the actions are extremely easy. So much so that we never had ambitions of launching an OSHA solution, right? That we were going to be a HIPAA compliant solution, but because we've hit on the processes and our platform's so easy to use, our customers are the ones that drove that need because they've asked about it so much. And so, we definitely have goals and to continue to evolve in that area, but ease of use and simplicity. And I know we've heard the same thing from our customers that utilize HR for Health.
Yeah, that's right. Yeah, it's funny you say that because I agree with you. I think ease of use has to be part of it because compliance is already super complex, right? And so it has to be easy for our customers to use. Otherwise, it's different. For us, we do ask our clients to log in and log out of our software every day, of course, because they have to clock in and clock out. And we want them to, obviously run their payroll reports and run things through us. But once they get set up, it is very easy to use because everything is so streamlined and easy for them to sort of find and navigate to. And despite both of our companies, I think, being leaders in what we do because we're pushing that envelope, as they say, disruptors never benefit, the incumbent, right? And that's what we've done, right? I think we both, have disrupted how people think about, HR and OSHA and HIPAA, because the old way of doing it, with, pen and paper and maybe you have somebody coming in once, every couple of years to do an audit or whatnot is really passé compared to kind of what we can provide now. And, from our perspective, we're the only HR software and HR advisory service that is dedicated solely for our doctor clients, right? So whether you're a dentist, you're an optometrist, you're a veterinarian, or just in the medical field, there's no one else that does exactly what we do for you from A to Z. Yes, there's a payroll company that might give you an employment manual, or there might be some small company that gives you a manual and that they write for you. But in terms of full service, that's that's what we're able to provide, and that's one of the reasons too why our customers don't get in trouble, right, from the federal government, states, or by their employees. And if they do, right, and if they do get in trouble, they have so much documentation and backup that they're in a much better place to succeed in that case or in those complaints that are filed. So we can never say we're going to be 100% lawsuit proof, right? Because we do live in America, but at the end of the day, we can limit that significantly. And if we can limit that significantly, for us, that's a win. And so that differentiation, I think, is what differentiates us. And of course, as you said, being able to get on quickly, use it, is a key component, because the less complex it is, the more the happier the customer, more importantly, but also the more they'll use it. So
yeah, absolutely, and they'll see the value of it. What you hit on something there that we talk about here at Abyde is we don't provide our services a la carte. It is a complete suite, and the reason why we do that is exactly what you just said. The last thing we want to do is provide any customer with a false sense of security that if they just do training or they just complete the security risk analysis, that they're going to be okay in the case of an audit. Our goal is to make sure that patient information is secure, that employees are safe and healthy, yes, but at the end of the day, the software is there to protect the practice in the case that anything goes awry, and data breaches happen, right? So to your point, if you can drop a stack load of documentation to the government on their desk after a data breach or after an employee complained about a certain needle stick or whatever, to prove that you were proactive in documenting your compliance program, I mean, that goes a super long way, rather than just providing a bunch of certificates of training, right? Proof of training, right? Which so many practices are doing, or they're just providing templated documentation out of their generic binder that doesn't provide any specifics about what their practice is doing. And we like to draw comparisons at that point to taxes. It's like, are you going to drop off generic tax documentation to the IRS? Absolutely not.
Right.
Same thing goes for your compliance programs.
Yeah, I had a doctor at a state association, at a very high level position, said to me, because we were talking about all this, he said, hey, look, it makes sense, right? If you come to me with, tooth pain and you say, hey, it's this tooth over here, I'm not just looking at that tooth, I'm looking at the entire mouth. And the same thing goes with, if you go in and you say, hey, one of my eyes, I'm not seeing so well, they're not going to just look at that eye, they're going to look at both eyes, and so the same thing applies in what you do and I do. We've got to make sure they're compliant, sort of, A to Z. But the nice thing is, that sounds a lot more complex, I think, than we make it, right? I think people think about HR compliance or OSHA and HIPAA compliance, and they're like, oh my God, I'm gonna have to do all this crazy stuff. And it's like, no. You just have to do them in order. And if we're simplifying it for you, if you do that, you're gonna be in good shape. So anyways, it's I think we've made that point, for both of our customers, which is why you guys have a ton of retention, and so do we.
Right.
Now, this is a slide I'm scared to show, because if my head of engineering, and I'm sure your head of engineering, if they're looking at this, they're probably like, what are you guys talking about? But in terms of our portals being connected, it's my understanding that our customers are going to have access to your site directly through our resource center. You might be doing something similar to that as well once your customers log in. But it's exciting that, over the course of time, we might be able to have even more intimate, connections, between the two softwares. So.
Yeah, I think where it makes sense, right? I think the benefit of what we provide is that Abyde's so easy to use, as we've talked about relentlessly today, as a standalone solution, that there would be some efficiencies built in. There's no doubt about it, right? But we are going to have a little bit of efficiency built in the beginning, right, with a link from HR for Health to Abyde. You know, on our side, our goal is to surround ourselves with organizations just like HR for Health that provide those complementary services that go beyond the HIPAA and the OSHA realm. Even though there is a little bit of overlap there between, HR and HIPAA and OSHA for that matter, but they're complementary services. And so we want to be able to promote those organizations, not only just when we're talking to them on the phone and providing our amazing service like we do on a regular basis, but automating some of those processes through the software. So it'd be dumb for two software companies to sit here and say, no, we're not going to be pushing and pulling information, back and forth in time. But I think, that'll be a nice to have. I think here in the early get-go, there's really not a need for that. And so as time goes on, we look forward to seeing what some of those opportunities are to where we can create some really nice efficiencies.
Well said. And if I get in trouble for saying anything, I'm going to say Matt said it, not me. This is in our roadmap. We've got to do it. So okay. All right, Matt. Let's talk about our partnership in terms of how it's going to help each of our customers. I think from my perspective, it sounds like it's a big part of what you guys believe. It's a big part of what we believe. It's in our DNA, which our main focus is to protect your practices, right? Every doctor's practice out there. I think we can do that even better than we've ever done because we're going to be, it's going to be more comprehensive because we've got you as a partner, and not just as any partner, but as sort of a leading partner in the OSHA and HIPAA industry. So we're super excited about that. And we think our clients are going to be, excited about that as well, especially as when you start getting into compliance and you start thinking about HR compliance, OSHA and HIPAA come naturally with that. And I think the same is true in reverse. It's hard to get compliant on those without wanting to be HR compliant too. So.
Yeah, absolutely. I think, we're preaching kind of a very similar message to the same group. And it's a holistic approach of making sure that these practices are compliant in these different areas. And, we love to educate. I mentioned it before. And so hopefully your customers will get sick of seeing us in an educational format, providing some education to them and vice versa. We love to do master classes with our customers, typically on a quarterly basis, and, exposing HR for Health to our customers through those master classes and really getting some, expertise to be, dropped on our customers. They've come to expect that out of Abyde, right, in the areas that we strive or we thrive in. But, up until we started this relationship, we haven't had anybody to send our existing customers to when they had those questions that, kind of originated through the HIPAA security risk analysis, and they started thinking about these things, but it really is HR compliance. And so to have, an organization that has, like-minded, and I think I mentioned it before, just, dynamic and easily accessible. And, those are things that not many companies are these days, especially when you combine that with great customer support, personal customer support. And so that's what we look forward to providing, to our customers as well.
Yeah, no, it's going to be really exciting, I think, for both sides. And congratulations on the CDA endorsement as well. We're excited to have you guys part of that family. And yes, our clients love education, maybe a little bit too much. They invite us to speak all the time at their study clubs and various other things. And, we love speaking at the state associations and various other things. So look forward to having you on a lot of those live webinars or seminars, and then also on the live webinars as well. It'll be exciting to put this message out. So now I'll let you talk about this. It sounds like we've got some special discounts and stuff available for both of our clients. So do you want to run through that with them?
Yeah, I mean, I don't want to pigeonhole ourselves, but we offer discounts for our partner practices. Typically starts right around 10%, but kind of just depending on what's going on at the time, if or any additional specials rolling through. But at the very least, it's a 10% discount, and we want to try to make it as easy as possible for customers to come on board. And we understand there's a financial commitment to that and an aspect to that. But again, we feel very confident and comfortable that our pricing, even without the discount, is pennies on the thousands of dollars, whether it's hard dollars or time spent, when it comes to implementing these vital programs that they need within their organization. But I'll just say this: we'll do our darndest to take great care of those HR for Health customers.
Yeah, thanks, man. I appreciate that. It's funny, when we started HR for Health almost 10 years ago now, I remember, the HR education wasn't really out there yet. We, like I mentioned, people were still, getting their manuals, whatnot, but nobody really thought about HR compliance the way they think about it now. And I think we were really responsible for, creating that messaging and creating that education and knowledge base out there. And, when we first started, people, sometimes were like, oh man, do I have to spend, $200 on HR compliance? Like they weren't sure about it, right? In the last many years, probably the last 7-8 years, nobody ever really talks about pricing with us anymore. It's like, because they know, like you said, it's pennies on the dollar, compared to what a lawsuit would be, what a settlement would be, what a government, in your situation, what a government, audit and penalties, could mean for them if there's a data breach or whatnot. It's sort of very cheap insurance for them, and I think people realize that, right? I think people realize that, this 10% that you guys are offering, we're offering the same for all Abyde customers off of our setup fee. We're excited about that. Again, we think it's just, it's sort of the cherry on top, right? I think we don't need to provide it, but we want to provide it just as a thank you for you guys being such great partners and whatnot. But we've got sort of a special thing on our end. If for anyone who's attending this webinar, if you want to take a picture of this QR code, you'll get our 2023 handbook and a lot of great information surrounding that. Of course, if you're in a state where you need a state handbook, you need some additional language, and we can help you put that all in there. But also you'll be able to learn more about us if you're an Abyde customer, and if you're one of our customers and you want this, let us know and we'll get it to you. And I know, Matt, you guys have something very similar as well for our customers and whatnot. You want to talk about that?
Yeah, so we have a HIPAA challenge. I think one of the biggest things for practices to understand is just like where do I currently stand, right? What I'm doing enough? And so we created this HIPAA challenge to, within minutes, I think it takes 3 minutes to go through. You answer about, I think it's about 8 to 12 questions, and we'll actually give a grade at the end of where your practice stands versus government requirements. And I think that's the biggest thing. Sorry, say that again.
I said, you're going to give a grade to doctors? Oh, man.
Unfortunately, we see a lot of red on there. But I mean, it's one of those, you have to be aware of where you stand. And then from there, you make the decision on what you're going to do next. So this gives a great way for practices to check themselves. No,
that's awesome. I love that. And don't worry, guys, these grades are not reported anywhere. This is all for you. It's, you can keep it to yourself. So. But Matt, this has been awesome. I'm super excited and pumped for our relationship, and looking forward to build on that, and seeing you out there and lecturing with you and teaching these doctors about HR compliance and having you teach them about HIPAA and OSHA compliance. It's going to be a lot of fun. I sound kind of like a geek and a nerd saying that, but anyways, it's fun for us.
I'm with you. I can nerd out on HIPAA and OSHA any day, or even compliance in general. So yeah, I mean, I guess the industry better get ready, because they're going to see a lot of us, right?
That's right.
Yes, and as we wrap up, I want to thank you both. I think for both of our mutual customers and those to come, exactly what Matt said, look forward to a lot of education coming your way. I know that from an HR for Health client perspective, you're used to us in your face about these law updates and what's happening throughout the year, and what mistakes you want to avoid, what are we seeing in terms of trends. And we are very excited to complement that education with the HIPAA and OSHA side of things, because it's, it doesn't end just at the HR, but anytime there's employees involved, which is for all of our worlds in the HIPAA, OSHA, and general HR, we want to make sure you guys are aware of what's happening. So much more to come on this, but thank you both so much for going through the partnership. We're very excited to launch it. Please use our resources. Again, HR for Health clients, you're used to seeing these checklists and how to keep yourself with what they're providing too. So we're excited to continue the momentum, but thank you both, and we will talk to everybody soon.
Great. Thank you, Jill. Thanks, Matt.
Thanks.
Bye, everyone.